Everyone, I'm Dr. Hari Senetti, oral and maxillofacial surgeon. Today I'm in my radio station, and one of the students asked me to tell how to prepare for PG. I cleared my PG, I got state 14th rank. That was a big struggle that time. Basically, I train students to prepare for PG. I tell them few important points. If you can follow these, I can give you in writing and put my stamp and give you. You can keep it as a copy. If you don't get nice rank or if you don't get selected, you can come and ask me, right? Follow them judiciously, right? First is you and the four walls will make you achieve whatever you want to achieve. You and the four walls. That is, you have to put your down and read, right? You have to do that. You have to sit down and read and read. There's no other alternative for that. So don't expect that without working hard, doing a smart work, or only reading the question papers, you will get a seat. You may get seat that way, but you will stay bad throughout your PG. You will be desperate. So you and four walls, that is, you have to take books, make notes, read and read. Nothing else should come in that 1 year if you're doing your internship and still working for that. So nothing can come in between. The other important aspect I want to highlight is, always make notes, store notes, keep on reading them, revise. People generally read, they think they understood, they think they remember everything, but when you go to the examination, you forget. So I suggest you to make notes and keep on revising them. Whenever, suppose you read one page, by the end of that day you have to revise that page for almost 20 times. Remember this logic. So how good is that? So if you revise one page for 20 times, where is the time for the rest of the subjects? This is generally question asked by my students. I say, if you can revise one page for 20 times, almost 2 3 marks are sure you will not lose anywhere. So each page you have to give it its time. People think reading more pages will give you more marks. No, reading even one page with full concentration, with full effort. If a question comes from that page, you will not miss it. So if you can read it that way, I'm sure you will be successful. Okay? Not that you read 100 pages and remember only 50 pages. There's no point. If you read even one page, you have to remember them totally, thoroughly. Whatever question comes from that, you have to remember. So for this, I have a principle, if you can follow me. That is 20 is to 5 is to 5. Right? This is compulsory. Remember this. 20 minutes you read a topic. It can be lengthier, big, small, 20 minutes only. You have to divide that section into 20 minutes. 20 minutes you read, and 5 minutes you revise, and the 5 minutes you take a break. 20 is to 5 is to 5. Remember this. Always, whenever you are reading, you divide your schedules into 20 is to 5 is to 5. If you can follow this principle, I think you will remember most of the points, whatever you are reading. Whatever you are reading, let it be anything, any subject. You read 20 minutes, 5 minutes you revise what you are reading, and 5 minutes you take a break. Okay? And the break should be 5 minutes only. Once, people have this, students have this, if I go out from that room, I will never come back on that day. So I keep getting distracted here and there. But that's how you should build up yourself. 20 is to 5 is to 5. Take 5 minutes break. Take 5 minutes break, and that's how I feel you become a yogi by doing all these things. You keep coming back towards it. You keep coming back towards it. And those who keep coming back will always win. Remember this. If you are not coming back, suppose you said, I will come back after 20 minutes to study. If you are not coming back after 20 minutes, then you are a failure. This has to be clear in your mind. So 20 is to 5 is to 5 rule for everything. At least during PG preparation for subject, you have to follow it. I follow even today. Whatever. Suppose if I'm trying to extract a tooth or trying to, debride something, 20 minutes if I work hard, if it's not coming out, I take a 5 minute break. I revise where did I go wrong or where, and then I start. I see surgeons doing rigorous surgery, working hard, but then they miss the entire concept of, thinking back that where did they go wrong. I suggest you to follow this 20 is to 5 is to 5 rule. Whenever you are studying or whenever you have any life problem also, follow my rule. This will help you a lot, right? Next is during PG preparation, students ask me, sir, which book to follow or which notes to follow or which PG academy to join. I say this to everyone. I want you all to follow this. Answer, read every material possible in the market. In the market, suppose you have 100 books, read 100 books. 100 books reading is difficult, right? But I'll tell you a logic. See, entire dentistry, if I start writing today, entire dentistry will have hardly 5,000 to 6,000, maximum 10,000 questions. Not more than that. You squeeze everything, you will get only 5,000 to 10,000 questions. That's it. Rest all are different angulations of the same question. The concept is same. You have 32 teeth. You have same wisdom tooth, same the questions, but they are in different formats. So you should not worry about the amount of the size of the book. You should understand that the concept is same. The questions come in different angulations. So get all the material available in the market. Suppose PG Academy is giving question papers or material, buy that. Get it. Your investment in papers, books, knowledge will never go waste. So at least buy them, pile them up. Okay, then you will have a target. Okay, I have to finish this. I suggest to buy all the books starting with Dental Pulse. These volumes are like Bible. You have to, are like Bhagavad Gita, are like Quran for dentists. So you have to read them. You have to finish them. How you finish your syllabus is secondary. First, you have to have all the material available in the market in your table, on your table. Once you have that on your table, then you can divide it. Now, as I told you, questions keep repeating, different patterns of the same question. Once you know the pattern, okay, you will understand it. So the next point is you have to know different patterns of question. Not that MCQ or the match the following type, or not the question patterns. I want you to understand that each topic will have different formats of questions, different angulations for that topic. So read in all angulations. Suppose if I say, pain pathway, you have different sets of questions for that pain pathway. You have to identify those. You have to identify what kind of questions that are being asked, and you have to dwell on them so that you will understand. The question may come like this. It appears same, it appears similar, but there's a slight twist in it. So you have to understand the twist. To understand the twist, you have to see different patterns of questions of the same topic, right? This, if you have doubt, you put it in the comment section. I'll repeat that. Then the other important doubt students have, or important point I want to tell you, is where to start, what time to dedicate on this subject. I feel all the subjects are important. There is no important subject, there is no specific subject to read, but oral pathology, oral medicine, radiology, pediatric, if you can become thorough in this, I think almost everything will be covered in this. So you should be thorough. The other very important point I wanted to suggest to all the PG aspirants is be particular about what you are reading. Be specific. Don't read superficially. Go deep. Read in detail about whatever topic you are selecting, because it will be related somewhere. First is when you are reading, first is answer the questions, then do the synopsis, then do the questions again. This is a ideal pattern you should follow. Generally, students read the synopsis and then do the questions. I would suggest read the questions, then do the synopsis, then again go back and do the questions. Okay, this way it will stay in your memory for a longer time. Okay, remember this. And most commonly what PGs generally do is they sit for long hours to study. Okay, don't do that. Divide your study time into 6 segments. One hour of 6 segments. In that, the 20 is to 5 is to 5 rule, that is 30 minutes of 2 segments. When you divide the 1 hour, morning 5 to 6, 8 to 9, then again if you are going to college, coming back at 4:35, 5 to 6, give a 1 hour break, 7 to 8, then after dinner 9 to 10, 10 to 11, like that. So divide into 6 segments, that's it, not more than that. You will not retain anything if you read more than that. 6 hours a day, more than enough for 1 year for dentistry. And if you are focusing like this, half an hour part you should study and revise, half an hour part you should do the questions. So the number of questions you are doing, number of papers you are solving, the chances that you get more marks. So you keep on solving more number of questions. That's all, because you know dentistry. If someone asks you questions on dentistry, you know how it goes, what happens. But when it comes to examination, you will not be able to think right at that time. So to develop that right thinking attitude, you have to do questions. Then easy technique, there is no easy technique. You have to work hard, you have to work hard, you have to work hard. There is no alternative for it, right? And if you when you are keeping a record of your whatever topics you are reading, I follow an index or bibliographic reference method. I'll tell you what that means. How I used to read. I used to read the subject, the questions, synopsis, and the questions again. This I would finish, and I would go back to the textbook, take out the index page. The last, according to the alphabets, they give index. Go to that index page and take out each word and try to recollect what all you remember about that word. Okay, that way you will revise so many new things. No one else could do that. Okay, so revise from the index. Go back to the textbook. At the back you have index. Read or try to recollect few points about each point in that index. And I used to do that. I used to go back, read index. I used to by heart index, and I used to recollect points whatever we remember in the index. Other easy a technique which I wanted to highlight is, remember the page numbers whatever you are reading. Suppose you are reading today 20 to 30 of that book. Remember the page numbers. Okay, when you are in examination, you can recollect it on the based on the page numbers you read on that day. Okay, if there is some topic on pediatric dentistry, and from that book you will remember, in that page I read, in that page I read. The other important aspect in PG preparation is group studies, or you go to these academies, and there is a target given by the academy. You have your personal target, and you get confused where to start, where to end. The moment you finish the examination, you feel you don't know anything. These things happen. So I feel you should have your own personal agenda. Forget about the academy. Academy has to be your, it's like an periodic assessment. That's it. Academy has to do nothing with your examination or your preparation. So I feel you should start behaving like you are already a postgraduate student, and then read in depth about that topic. Whatever you are reading, whatever topic you are reading, you have to read in depth. That's very, very vital when you are reading for PG entrance examination. And make notes, put codes, and make lot of effort to revise, That's all. That's what matters a lot when you're doing PG preparation. It's not difficult, people. I'm telling you, there are seats left out now. Okay, so PG preparation is not difficult.